Georgie, thank you. Well, a 7-day online therapy program is helping to change the lives of people suffering from social anxiety disorder, a common mental health condition affecting around 1 in 7 Australians. Dr. Kayla Steel from the Black Dog Institute at the University of New South Wales measured the effectiveness of this intensive course, and she joins us this afternoon. Doctor, this is great news. Why was this course so effective?
So this treatment was so effective because we took the core components of cognitive behavioural therapy, which is an evidence-based psychological therapy, and we distilled it into a shorter or briefer time frame. So participants were getting the best treatment in a more intensive frame, so we were seeing the results really fast.
So how does this program actually work?
So what we do is we take the psychoeducation components, thought challenging exercises, and then facing your fears or exposure-based activities, and we combine them with social skills training. And people go online to do this treatment, and with support from a GP or therapist that helps to coach them through practicing the skills and activities at home.
And how important is that? Because getting access to great therapists or support groups is not only very difficult, but it's very expensive. So is this quite a cost-effective way to actually help people who are struggling with this disorder?
Yes, absolutely. And that's why it was so important for us to do this kind of research, because in a cost of living crisis, as we know, there can be really long wait times to access mental health care, and also treatment can be very expensive. So what we wanted to do is see if we could take this evidence-based specialist treatment and distill it into an intensive or short time frame and make it low or no cost to help more people access treatment.
We mentioned before in the introduction, this is an incredibly common disorder. Can you explain how the disorder manifests itself? Like, what symptoms would you have and how crippling can it be?
Sure, yeah. So it is a very common disorder, like you mentioned before. It affects around 1 in 7 Australians. And so it's a serious mental health condition where social situations, including performance situations, cause people to experience overwhelming fear or anxiety, and that significantly impacts their ability to function in daily life. So we're talking work, studying, relationships with family and friends. And so what we might see with someone with social anxiety disorder is they have a lot of the physical symptoms. So they might feel that their heart's beating really fast or racing, they might feel very sweaty, they also might feel a shortness of breath, and then they have these thoughts that are associated with those physical symptoms. So they might think to themselves, oh, I'm making a fool of myself, I'm embarrassing myself, everyone is judging me or people are criticising me. And then the behaviours that come along with that. So that might cause someone to avoid certain situations, to avoid talking, to avoid speaking up, say at work or in a family or friendship situation.
It's such an important step forward. Thank you so much for joining us, Doctor, and congratulations on the work.
Thank you so much.